Welcome back. This morning on Great Day Louisiana, we are talking about varicose veins. Did you know that they are more than just a cosmetic problem? They are actually an indicator of a more serious issue. But don't worry, this morning we have Dr. Randall Juleff, the owner and medical director of La Bella Vita Laser and Vein Center. He is here to tell us how they can help. Welcome to the show, doctor.
Thank you very much.
Thanks so much for joining us this morning because, this is something that people can see cosmetically, but again, it's something that can lead to something more serious. First, I want to ask you, what does it mean when someone has varicose veins and how do we get them?
Well, varicose veins nearly all the time indicate that there's a problem with the venous system that's actually deeper in the leg. So when we see people with varicose veins, the thing that we're more interested in is defining if there is a functional problem with the veins, again, that are deeper in the leg that needs to be addressed, because typically we need to address both. We need to address not only the superficial varicose veins, but we also need to address that underlying functional problem so that the process doesn't continue.
Very interesting for sure. Now, for me, doing research, I always thought varicose veins were spider veins, but they actually are different. What are the differences?
Yeah, they're veins that are in a different location within the leg. For instance, spider veins are the most superficial veins that we have, not only in the legs, but everywhere, but mainly we see them in the legs. And spider veins often, or most of the time, are a part of what we call the venous insufficiency process. So when the functional problem happens in the deeper veins, then the pressure, abnormal pressure and flow gets transmitted superficially, and that's when we start to see those dilated veins in the skin. Those are veins that are already there, but they become dilated because of the process.
Fascinating.
Now, varicose veins, on the other hand, are veins that are a little deeper in the leg. They're veins that are underneath the skin. And since they're bigger, they're a little deeper, the way that we see those are as bulgy kind of, protuberances underneath the skin. And sometimes they can be pretty dramatic, like the picture that we're looking at right now.
Unbelievable. And I know there are many signs and symptoms that can happen because when you think of varicose veins, spider veins, you only see something maybe visually, but that can mean something bigger happening on the inside. You're seeing varicose and spider veins in the photos, but it can also lead to venous ulcerations.
Yeah, well, and that's the hurdle that we often have to get over, and that's why I like doing these kind of things to educate people, because it's not just varicose veins that we're dealing with. The whole process of venous insufficiency, there's a whole spectrum of signs and symptoms. And sometimes people have very dramatic venous insufficiency and don't have any varicose veins. And often those people that are further along on sort of the severity scale of the whole process, often those people don't have just varicose veins. So, some of the other symptoms that we talk about are things like achiness, heaviness, fatigue, muscle cramping, something that we call restless leg syndrome. People can have all of those symptoms, and they may not have anything superficially. Their legs might look perfectly normal. So when people have those types of symptoms, we encourage them to come in and be evaluated, because very often we can help them by addressing that underlying functional problem with the deeper veins. For instance, especially in our older patients, many of them have such a terrible problem with muscle cramping, muscle cramping that occurs at night. And it really can be very disruptive to their sleep patterns and their quality of life and all that sort of thing. And often addressing, again, that underlying venous insufficiency can make a world of difference and just improve their quality of life tremendously.
And I know, doctor, at your place that you all do things, whether it's vein screenings to evaluate treatment, but you also do procedures. We have some before and afters we want to show people. What do you do at La Bella Vita to help get rid of these varicose veins or spider veins?
Well, luckily, fortunately, the procedures that we do these days are much more easily undertaken, not only for us, but also for the patient than it was, 15, 20 years ago. Back in the old days, we used to do something that we called surgical vein stripping. And surgical vein stripping was, a procedure that we did in the operating room. It required a general anesthetic. People usually stayed in the hospital several days. And all of that stuff we do now in the office under local anesthesia.
Which is
And
great.
yeah, which is tremendous for the patient. I mean, the patient comes in, they have a procedure. Usually it takes 30, 45 minutes. And they leave with a dressing on their leg and they virtually go on with their day. They can really pretty much do whatever they want to.
Some great information, Doctor. Thank you so much for joining us this morning. And hey, here's some good news, everyone watching right now. There's a special offer for you. La Bella Vita Laser and Vein Center is offering free vein screenings by appointment. They have 2 locations, one in Covington on Ochsner Boulevard and the other in Metairie on Galleria Drive. For more information, log on to labellavitavein.com or give them a call at 985-892-2950. Stick with us. We'll be right back.